Can acupuncture help your aging pet? Today on Senior to Seniors, I'll be focusing into a compassionate look at one of veterinary medicine's fastest growing treatments. Hello, my friends, and welcome back to another edition of the Senior to Seniors podcast. I'm Jim Mazziotti. If you've listened to this podcast for any length of time, you already know that I love helping seniors navigate life's important decisions. We talk about housing and finances, scams, health, retirement, and living our very best lives. But today, we're talking about another member of the family, our pets. And if you're like me, they're not just animals, they're companions, they're family. They're our comfort after a difficult day. They're our reason for getting outside. Sometimes they're our best listeners. And for many seniors who live alone, they're often the first face we see every morning and the last one we see before going to bed at night. I've been blessed to have many wonderful dogs throughout my life. Each one had a different personality. Each one taught me something. But there was one that captured my heart and the heart of my family unlike any other. His name was Copper, and Copper was a Rhodesian Ridgeback mixed breed, and he was one of those once-in-a-lifetime dogs. He wasn't just loyal, he understood people. He knew when someone needed comfort. He knew when it was time to play. He knew when it was time to rest. And somehow he always knew when I simply needed a friend. Those of you who have loved a special dog know exactly what I'm talking about. You never really forget them. They always seem to be in your memory. Today, I like to think Copper would wag his tail in approval of today's conversation because we're discussing something that has been helping many aging pets live more comfortable lives: veterinary acupuncture. Now, I admit, years ago, if someone had told me they were taking their dog to receive acupuncture, I probably would have smiled politely and wondered if they had lost their mind. Needles? In a dog? Acupuncture? Really? But as I began researching this topic, talking to veterinarians, and reading what the medical community has to say, I discovered there's much more to this story than I ever expected. Today, I simply want to share what I've learned with you. Not to convince you, not to sell you, but to help you become informed because our pets deserve that. So what exactly is veterinary acupuncture? Most of us think of acupuncture as an ancient Chinese treatment involving tiny needles placed in different parts of the body. Well, that's essentially correct. Veterinary acupuncture uses extremely fine sterile needles that are inserted into specific locations on an animal's body. The treatment is always performed by a licensed veterinarian who has received specialized acupuncture training. The needles are much smaller than most people ever imagine. Many animals barely react. In fact, some become so relaxed they actually fall asleep during the treatment. Now, that's something I never expected to learn. So why would someone consider it? Well, the biggest reason is pain. Just like us, our pets develop arthritis. Their hips begin hurting. Their backs become stiff. Old injuries return. Climbing stairs becomes difficult. Even getting into the car isn't as easy anymore. That energetic puppy who once chased tennis balls for hours suddenly hesitates before standing up. If you've ever watched your aging dog struggle to get up from the floor, well, you know how heartbreaking that can be. Veterinary acupuncture is most commonly used to help manage chronic pain, but veterinarians also use it to complement treatment for arthritis, hip problems, back and neck problems, recovery after surgery, certain neurological conditions, muscle injuries, chronic inflammation, and sometimes to improve overall mobility and quality of life. Notice I use the word complement, and that's important. Acupuncture is generally considered an additional treatment, not a replacement for traditional veterinary medicine. So does it really work? That's the question so many people ask, and the honest answer is sometimes. The scientific evidence is strongest for helping manage chronic pain, especially arthritis. Some clinical studies have shown improvements in mobility and comfort. Other studies have shown less dramatic results. In other words, researchers are still learning. Organizations like the American Veterinary Medical Association recognize acupuncture as part of what they call integrative veterinary medicine. That means it may be used alongside conventional medicine when appropriate. The key words are alongside and when appropriate. No reputable veterinarian is suggesting that acupuncture replaces proper diagnosis, surgery when necessary, medications, or emergency care. Instead, many veterinarians see it as another tool available to help certain patients. And honestly, if something can safely reduce pain and improve an older dog's quality of life, well, don't you think it's worth having a conversation? It's a growing profession. Veterinary acupuncture isn't some unusual hobby practiced by only a handful of veterinarians. Today, an estimated 4,000 to 5,000 veterinarians in the United States have completed formal acupuncture certification. About 80% of them primarily treat dogs and cats. Others specialize in horses, farm animals, wildlife, and even zoo animals. These veterinarians complete hundreds of hours of additional education beyond veterinary school. Many study anatomy, neurology, pain management, rehabilitation, and both Western and Eastern medical concepts. So this isn't someone taking a weekend seminar. Proper training matters. So what happens during a visit? Well, most appointments begin with a complete examination. Your veterinarian wants to understand the entire medical picture. After all, if a dog suddenly can't walk, you don't automatically assume acupuncture. There could be a slipped disc, a torn ligament. There could be cancer or another serious condition. Diagnosis always comes first. If acupuncture is appropriate, the veterinarian carefully places tiny needles into selected points, and treatments usually last around 20 to 30 minutes. Many owners report their pets becoming very relaxed. Some dogs simply lie down, some cats purr, others even drift off to sleep. Of course, every animal is different. The question is it safe? Well, when performed by a properly trained veterinarian, yes. Side effects are generally uncommon and mild. Some pets may feel tired afterward. Occasionally, there's temporary soreness. Serious complications are considered rare when performed correctly, and that's why it's so important to choose someone with the right certification. So is everyone convinced? No. And I think it's important we say that. Some veterinarians remain very skeptical. Some researchers argue that there still isn't enough high-quality scientific evidence to fully explain how acupuncture works or how effective it truly is. That's a fair discussion. Science asks hard questions, and that's healthy. At the same time, many experienced veterinarians and thousands of grateful pet owners have seen animals become more comfortable after treatment. Those experiences shouldn't replace scientific research, but neither should they simply be ignored. Medicine often advances because caring professionals ask questions. Our pets grow old too, as seniors. Many of us understand something younger people haven't experienced yet, and growing older changes things. We move a little slower. Our joints remind us when it's raining. Sometimes we need a little extra help. Well, our pets experience exactly the same thing. They don't complain. They don't tell us where it hurts. They simply slow down. Sometimes they stop climbing stairs or jumping up onto the bed. Sometimes they quietly endure pain because that's simply what animals do. It's our responsibility to notice. Copper. When I think back on Copper, I often wonder, if veterinary acupuncture had been as common then as it is today, might it have helped him? Maybe, maybe not. I'll never know. But I do know this. If there had been something safe that might have made his later years more comfortable, I think I would have explored it. Not because I expected miracles, but because he deserved every opportunity to enjoy life. And I suspect many of you feel exactly the same way about your own pets. Well, my thoughts? If your dog or cat is slowing down, if arthritis seems to be stealing their joy, if medications aren't providing enough relief, have a conversation with your veterinarian. Ask questions. Learn about every available option. That may include rehabilitation, weight management, laser therapy, prescription medications, supplements, or even acupuncture. Every animal is unique. There is no single solution for every pet, but knowledge helps us make better decisions. So before we close today, I'd like you to do something for me. If your dog is lying beside your chair, give them a gentle scratch behind the ears. If your cat is curled up in the sunshine, take a moment to appreciate that quiet companionship. They ask for so little: a meal, a walk, a warm place to sleep, and our love. In return, they give us unwavering loyalty, unconditional love, and memories that stay with us for a lifetime. My dog Copper certainly did. Thank you, my friend. I hope today's conversation gave you something new to think about. If you found this episode helpful and interesting, please share it with another pet-loving friend, especially someone caring for an aging dog or a cat. Until next time, I'm Jim Mazziotti. Thank you so much for joining me on another edition of the Senior to Seniors podcast. Take care of yourselves, take care of one another, and don't forget to take care of those faithful companions who have spent their lives taking care of us. Have a fantastic day.